Today, we're going to highlight evidence-based medicine, new innovations, patient safety studies, and of course, groundbreaking science. Today, we will learn about quality of life as reported by breast cancer survivors, how surgeons weigh in on cleft lip repairs, and the role of 3D printing in plastic surgery. There are 4 major types of abdominal-based autologous breast reconstruction, but are they truly all equal? There's a pedicle tram. There's a type of breast reconstruction where blood vessels called deep inferior epigastric perforators are included with the skin as a free flap. There's a muscle-sparing tram flap, and of course there's a free tram. Authors of this important study looked at the quality of life and patient-reported outcomes in these 4 different types of reconstruction. I think this is very important since they were patient-reported outcomes, not our outcomes. This study discovered that both the surgeon, and we've seen this time and time again in plastic and reconstructive surgery, that free tissue transfer gives you the best, most natural-looking reconstruction. It's perhaps the most complicated, but it has the least morbidity, at least complications, and that's actually what the patients saw. They like that operation. To them, they have a nicer-looking breast, they have less complications, and so this is a very important landmark type study because it, I think, one of the first times correlates what the surgeon thinks is a good outcome with the patient. And often that's not the case for both surgeons and patients to say, you know what, this is a good technique. The next special topic is a nasoaveolor molding appliance, which is used as a nasal stent to help mold the alveolar ridge in cleft palate patients. This is a very important topic in the management of congenital deformities. Both surgeons and caregivers weighed in on how primary cleft lip and palate and nasal reconstruction looked like with and without alveolar molding. The very important thing about this is in parallel to the previous study, that now we are looking at not only what we as physicians think is the outcome, but also what other caregivers or patients themselves think of the treatment, which really in the end is the most important, because patient-derived outcomes are more important than what we think is outcomes, because if the patient's not happy, then we are not happy in general. So these are all very important studies that highlight this important concept, which has evolved in all of medicine. So in summary, physicians and caretakers agreed that this treatment provided similar or better results than cleft lip repair alone, even in patients who had more severe cleft problems initially. The next special topic discusses the past, present, and future applications of 3D printing, a very hot topic in plastic surgery. While it was technically developed in the early 1980s, lower costs of printers and materials have made 3D printing a much more of a reality, both in homes and in the operating rooms in the last 8 to 10 years. Medical 3D printing is defined as the manufacture of dimensionally accurate physical models of human anatomy that are derived from medical image data. And really all this has done is put this to use to develop accurate pre-operative planning in craniofacial or maxillofacial, spinal, and cardiovascular surgery. 3D medical printing is still in its infancy, however. These authors believe that the future of this unique tool will allow for a much lower cost solution for scaffolds for potential soft tissue reconstruction, and to develop lifelike models and prostheses, including breast implants, tailored to the patients, and eventually to allow them to see what the result is before it's actually done. But I think where it's going to help everybody in plastic surgery is that with the advent of being much more cost effective, you'll be able to do 3D printing models to show a patient what they look like now and what they can look like after reconstruction or after cosmetic surgery. So that I can take someone and show him or her his 3D nose before surgery and what it can look like after a rhinoplasty. So this should actually allow you to have much better patient outcomes because you'll be able to see what's possible and what's not. If you want the best of the best in peer-reviewed literature, please tune in to the Journal of Plastic and Reconstructive Surgery. Visit prsjournal.com. And if you're interested in plastic and reconstructive surgery, please visit plasticsurgery.org to find the best board-certified plastic surgeon in your area.